Well, thank you. And now I'll go to the gentleman from Pennsylvania, the member of the Social Security Subcommittee, Mr. Smucker.
Thank you, Mr. Chairman, for calling this hearing today. Thanks to each of you for being here, particularly Mr. Tyree. Wonderful to hear your story, and we want to ensure that as many people as possible can follow a similar path to what you have, what you have followed, where you're able to return to or enter the workforce and have great employment opportunities like you've described. And so it's frustrating when sometimes we hear that a return to work program can be so complicated that it actually keeps people from working. And I really think the Social Security Administration has a responsibility to help the people that it serves understand their benefits so that they can use those benefits to help themselves, just as you shared. That, by the way, that's why I'm working on another bill with Mr. Byer to provide clarity to older Americans deciding when to begin claiming their Social Security in order to best meet their financial needs. It's about having the information available and explained in a way that people can understand, so that's an important bill as well. But it's even more confusing at times and worse for those drawing disability benefits. Dr. Hoffman, in your testimony, you contrast the ways that SSDI and SSI calculate eligibility. For example, SSDI has a cash cliff that scares people away from working and saving money, while SSI phases out benefits at a 1 for $2 offset. How can we better align these programs' phase-out structures to reduce confusion and maintain incentives to work?
Yeah, so I think this builds into the Section 234 demonstration authority that had expired several years ago. I don't think that there is a clear solution. I think there are several compelling ideas, but I think that they need to be vetted and tested to ensure that they can achieve administrative feasibility, that beneficiaries can understand them, and to test whether they can, in fact, in the real world, achieve policy goals.
Sure. Well, thank you. We'll hope to have your continued input as we work to address that. Mr. Tyree, considering what Dr. Hoffman just said about the benefits cliff, the threat of a benefits cliff, you'd mentioned the ABLE accounts, and this was actually a priority of mine for reconciliation, and I'm really grateful that we were able to get it across the finish line in the bill that we just passed. I've heard a lot from the treasurer in Pennsylvania how individuals with disabilities have been able to access this program to build their assets without a threat of losing benefits. So could you just talk a little bit more about how your ABLE account helped you to work towards financial independence while returning to work?
Yes. So I would say, like I said, the combination of services and support is critical. But specifically talking about ABLE, I'm not even sure I could be competitively integrated employed without it, simply because of that $2,000 asset limit that's set out by SSI and SSDI. Because during that 9-month trial work period, between my wages and what I was receiving from SSDI and SSI, it well exceeded that $2,000 asset limit. And without the ABLE account, I wouldn't have been able to put that money anywhere to be competitively integrated employed in the state of Kansas. So I would say it was almost more than critical in me finding competitive integrated employment.
Sure.
Thank you.
Well, yeah, thank you for sharing that. Again, thanks to each of you for being here. And with that, Mr. Chairman, I yield back.